Deep sliding systematic palpation of the abdomen, the transverse colon. Perform hand washing before the contact with your patient. Provide privacy. Prepare all the equipment on the procedure trolley. Greet your patient warmly and politely. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient or family present. Manipulation can be performed with disposable non-sterile gloves when it can be the risk of contact with patient's biological fluids. Ask the patient to undress to the waist. Use supine position of your patient for palpation. The room should be warm, your hands should be warm, cut your nails before palpation. The couch is pre-prepared, clean with napkins. Sit on the chair to the right side of the patient for the right-handed doctor. The chair seat is at the level of the couch. The patient is lying on his back, his head is lying low on the couch, his arms are stretched out, the abdominal muscles should be relaxed, and the patient's breathing should be calm, preferably with his mouth. It is necessary to determine the inferior border of the stomach by one of three methods: percussion palpation, auscultar percussion, or auscultar friction, a scratch test, before the intestinal palpation. The both hands you should place on the sides of the linea alba. The fingers of the hands are located 2 centimeters below the level of the previously founded inferior border of the stomach. The palms of the hands are facing to the umbilicus. With a superficial movement during deep inhalation with the abdomen, the fingers are displaced up and the skin fold forms in front of the fingers to epigastrium. Then place your fingers gradually to the intestinal wall during the relaxation of the abdominal wall, during the expiration of your patient. The examining hand should slide down to feel the intestine. Breathe in, breathe out, and palpation. Identify diameter, consistency, surface, mobility, pain, and rubbling phenomenon. Normal transverse colon can be palpated in 60–70% of cases. This is a cylinder of moderate density, near 2.5 centimeters in diameter, painless, silent, and movable. Assist dependent patient in dressing, explain the data obtained during palpation, perform hand hygiene, discard disposable equipment, record the procedure in medical record as required.